Good afternoon, everybody. Let me introduce the title of my PhD thesis, which is the impact of triglyceride level on the risk and outcome of different diseases. My name is Luca Havelda, and I'm a clinical dietitian working at the Institute of Pancreatic Diseases, Semmelweis University. I would like to contribute to the prevention of diseases in association with hypertriglyceridemia. This is my vision, and therefore my mission is to provide and collect evidence-based and valuable data to help in this prevention. To achieve my mission, I have two specific goals. The first one is investigating the effect of different triglyceride level on the development of diabetes mellitus. This project started this September, and it is going to be a systematic review and a meta-analysis. My second project is in connection with my first one. It is also investigating the effect of different triglyceride levels, but on the outcome of COVID-19 disease. And this project started this November, and it is going to be a registry analysis. As I mentioned, my first topic is investigating the effect of different triglyceride levels on the development of diabetes mellitus. Currently, I'm working on this systematic review and meta-analysis with two co-investigators and two project students. The prevalence of type 2 diabetes mellitus more than doubled in the last 20 years, and by 2040, it can more than 600 million patients can be type 2 diabetic mellitus cases. 92% of these type 2 diabetic mellitus cases are preventable among men if the risk factors are eliminated in time. The association between hypertriglyceridemia and diabetes mellitus is highly investigated, but whether there is dose dependency is still not quite understood. Based on the guidelines, triglyceride level falls into three main categories regarding the heart risk. This is the normal one, the borderline, and the high. The association between diabetes mellitus and hypertriglyceridemia is quite important, given that the prevalence of hypertriglyceridemia is really high. It can reach almost 50% in men during middle age. Therefore, our aim is to investigate the dose-dependent effect of hypertriglyceridemia on the development of diabetes mellitus. Our clinical question: does hypertriglyceridemia dose-dependently contribute to the development of diabetes mellitus? And to answer it, we are going to use a PO framework, where the population is adult population, the exposure is different level of triglyceride, as the mentioned normal, borderline, high, and the outcome is the risk of diabetes mellitus. We have also additional outcomes, like the risk of prediabetes, impaired fasting glucose, insulin resistance. Our hypothesis is that hypertriglyceridemia is a dose-dependent risk factor of diabetes mellitus. And with this information, we would like to create better prevention and follow-up plans for patients with more effective education and lifestyle strategies. To find the useful articles, we have conducted a systematic search on the beginning of November. We used three databases: the Medline, Embase, and Cochrane. Our final search key contains three domains. The first one was about dysglycemia, like diabetes, impaired glucose tolerance. The second domain was about hypertriglyceridemia, and the third one was about those studies which can be useful for our research. After this systematic search, we had a pool of 31,000 of articles. And after the automatic and manual duplication removal, we have a pool of 21,000 articles. We have finished the title abstract selection, and you can see that our full text selection is going to be done by 400 articles. Here you can see my progress so far about the first project. Now we are searching for the full text articles, and we hope to start the full text selection tomorrow. My second topic is investigating the effect of different triglyceride levels, but on the outcome of COVID-19, and we plan to do a registry analysis. As we all know, from 2019, a new infection, COVID-19, became a health-affected virus infection, which affected millions of people. Its outcome was influenced by several factors, which should be identified to be able to interfere as soon as possible and do early intervention when needed. As I earlier mentioned, the prevalence of hypertriglyceridemia is quite high. It is approximately 29%. And in the latest studies, hypertriglyceridemia was associated with inpatient mortality among COVID-19 infected. However, this association between the different triglyceride levels and the outcome is still not clear. It is important to highlight that although it seems that the huge wave of COVID-19 seems to be over, there were a lot of SARS virus outbreaks before 2019, and learning from our history, we can expect to see more global pandemic in the future, which can be similar to COVID-19. Maybe they can be coronaviruses as well. Therefore, our aim is to investigate the dose-dependent effect of hypertriglyceridemia on the outcome of COVID-19. And a clinical question, does hypertriglyceridemia dose-dependently worsen the outcome of COVID-19? Here we would like to investigate patient who has COVID infection, and the exposure would be the same, the different level of triglyceride. Our outcome is regarding the severity of COVID-19 disease. We plan to include mortality, intensive care unit admission, the need for mechanical ventilation, and the lack of hospital stay. Our hypothesis is that hypertriglyceridemia is associated with worsened outcomes on COVID-19 disease dose-dependently. With regards to its clinical implication, it is important that once we have assessed the impact of different triglyceride levels on the severity of the disease, we may have the chance to interfere as soon as possible, transport the patient to the most optimal ward, and maybe do early interventions, and we may have the chance to reduce the severity of the disease. We plan to use the coronavirus registry created by CATLAG study group. Its aim was to understand the development, epidemiology, and therapy of SARS-CoV-2 infections, and it was a multi-center registry. More centers participated in that. To summary my progress so far, we have two ongoing projects. The first one is investigating the effect of different triglyceride levels on the development of diabetes mellitus, and the second one on the outcome of COVID-19. The first one is going to be a systematic review and meta-analysis, and the second one is a registry analysis. We plan to publish both of them in 2024. Thank you for your attention, and always remember Hippocrates' wise word, leave your drugs in the chemist, but if you can cure the patient with food. Thank you.
Great lecture. So about the second topic, just a quick question. So COVID-19 has an unique identity when COVID-19 triggers so-called macrophage activation syndrome. Which diagnostic criteria is that it has to be hypertriglyceridemia? So you focus on COVID cases with lung disease, or you also focus in that case, which is a different entity, and have a worsened outcome?
The registry included patients with diagnosed COVID infection, not just with COVID infection lung disease patient, and we hope to find association between triglyceride levels and any kind of mortality, not just the need of mechanical ventilation and the severity. Thank you for the question.
Congrats on your presentation. I wanted to ask you, as far as I know, statins can increase the risk of diabetes, and I suppose many patients with hypertriglyceridemia also have high levels of cholesterol and they use statins. How do you plan to differentiate between the risk that is given by statins and the risk of triglyceridemia?
Thank you so much for this question. Both statins and fibrates has the potential to increase the risk of diabetes mellitus, and we have met several articles during the title abstract selection. We excluded those cases when they investigated the effect of statins and fibrates, because we are not really concentrate on that part, and they can increase the possibility of type 2 diabetes mellitus. Thank you.
Do you focus on the triglyceride levels at the time of the diagnosis of the diabetes?
No, before. We plan to include. That's a really great question. We plan to include cohorts and population-based observational studies, and usually there are like 10 years of follow-up. we don't know the specific time when they develop the diabetes mellitus. We know the baseline, and we know that after 8 years or 10 years or 15 years, how many patients did develop diabetes mellitus. So therefore, we cannot really know the time of the new onset diabetes mellitus. We just know that for those who had a higher level of triglyceride at the baseline, who were diabetes-free and pre-diabetes-free, had a higher chance of not getting but developing diabetes later on.
And does this correlate with the BMI?
Yeah, it can be correlated with the BMI. We hope to find information on that also.
So you plan to do a subgroup analysis? Subgroup analysis regarding this?
Yeah, there is going to be a subgroup analysis according to the different triglyceride levels, but we are going to be only able to see what can we do after the data extraction or the full text selection, what kind of information can we find in the publications.
Is there any theory behind this? Isn't it a chicken and egg problem?
Yeah, as I mentioned that with diabetes there is an association. We know about the association. A lot of diabetic patients develop triglyceridemia, and we plan to know the risk, like the dose-dependent risk, that how much more the chances when you have like this kind of triglyceridemia. It's known, but I think it is really important when we educate patients to know the exact number.